Okay, I'm going to get started while a couple more people join us. I just want to welcome everyone to our second session in our winter webinar series, Health and Equity Making Systems Accountable. And some of you have attended some of our previous webinars that we've been hosting since April. We hold these health and equity webinars on a monthly basis, which is part of our way of gathering our community to have ongoing and timely conversations about equity and accountability so that we can continue to advance our knowledge, learning, and practices in this area. My name is Erin Wolfson, and I'm the Community Engagement Specialist in the College of Medicine at the University of Saskatchewan. And we begin today's webinar by acknowledging that we are meeting on Indigenous land. And the Division of Social Accountability is located in Saskatoon on Treaty 6 territory and the homeland of the Métis. And as a white settler and guest living on this land, I am grateful for the opportunity to meet today on this land. In the DSA, we continue to learn about this history of systemic racism and discrimination for Indigenous peoples in our province and in Canada. And we also continue to grow our understanding of how that history is alive today in our systems and society. And we continue to ask ourselves what we can do about it. So please, wherever you're joining us from, do your own silent acknowledgement of the land. Briefly, on the logistical side of things, I'd like to start by going through an etiquette slide for participation. Sorry about that. Sorry about that. All right. And so just to let you know that your audio has been muted to reduce feedback, but your video is enabled. So feel free to turn that on and off as you wish. It's certainly great to have your video on during the discussion portion of the webinar. Please make sure to see that your name is on your screen. So just make sure that your actual name is listed, not just your device name or someone else's name. And you can do that at the bottom by pressing on the participant icon. We have closed captioning available, and you can find that on your screen. You can turn that on and off if you would like to use that. We are playing a few different roles in the session today. If you have any technically related questions, you can send a message to the help person. You'll see the word help beside my colleague Erin Walling's name, or to any of the hosts or co-hosts. If you have any questions about navigating the space online, any logistical or technical questions. We are going to have the chat open for the beginning of the webinar, but then we will close it during the presentation until the discussion portion. So I will be the Q&A person. You will see beside my name is Q&A. And as questions or comments come up for you, please feel free to send them to me and I will curate them for our speaker. I just want to thank the entire DSA team for your support throughout this webinar, for being here today. And for what's really important for the DSA and for the series, as I mentioned earlier, is that this is a time and a space where we can learn together and connect. And there may be moments to share some experiences and perspectives. And there is incredible diversity in our gathering here today, diverse backgrounds and racial and gender identities. And there's so much that we share, as well as different ways that we see the world based on our different locations. And all of that is wonderful. But I will mention that if there's any disrespectful words or behaviors on this call, then we will politely exit you from the call. So the topic for today's webinar, patterns of white dominance in healthcare. And yes, this is a big topic and a really important one. And we really hope today's conversation is the first of many, where we will begin to explore how whiteness shows up in our systems at different levels in ways we often don't notice or question. And I wanted to mention that this topic of racism and patterns of whiteness is not unique to our university, to our college, to health education or healthcare, or to any one system, any one organization or institution. The context is universal. Before we begin, I just want to take a quick moment of pause. So many of us spend so much time on these virtual calls. So I just want to invite you to pause and just to connect in with what brought you here. And I'm going to invite you to take in 3 breaths on your own time, maybe shifting your gaze away from the computer, finding a place in your room, wherever you're sitting currently, and just use these breaths as an opportunity for your thoughts to settle, to check in, to notice how you're doing, notice how your body is doing, and what brought you here. What are you here for today? Wonderful. and just acknowledging that we're having this conversation in a global pandemic. And so as we go through the conversation, hold yourself gently and acknowledge that this conversation may have different impacts. And so show up the way that you need to. And wherever you are in your own learning, unlearning or relearning about systems of whiteness, we want to welcome you to this space and this dialogue. We just really appreciate for being here for this important conversation. And I'm just so looking forward to it. And so on that note, I'd like to introduce our guest who will be leading today's conversation. Sharissa Hantke is a white settler and a community health clinical nursing instructor working on a master's in educational foundations at the University of Saskatchewan under the supervision of anti-racism expert Dr. Verna St. Dennis. And Sharissa seeks to work for racial justice by learning in her own complicity in colonialism and her responsibility to push for a critical anti-racist lens in nursing education. Rissi, I'm so grateful that you're here today to share with us your knowledge on this topic and for guiding us today in this conversation. And I will hand it over to you to get us started.
Well, thank you so much. And it's such an honor to get to speak today, something I don't take for granted and I hold with a bit of uncertainty about this opportunity that I have, but I come to you hoping that we can have a good session today. As Erin said, my name is Sharissa Hantke. I'm going to start sharing some slides. Had a quick glimpse at all the lovely faces that I can see right now, and it's really heartwarming to see some kids, and even my niece is here. Wow, I'm so honored to get to share with you all for the next little bit here. So the title of my my time today, my slides here are "And I Feel Like I Still Have a Long Way to Go." And I'm going to be presenting you with some of my research that I've been working on for my graduate studies. And this is a quote that somebody said during the research. And it's a quote that's really stuck with me and that I feel like I have a long way to go. So I felt like I could really relate to what they were saying. And so it seemed like a good thing to title my presentation. I'm not coming to you from a place of knowing it all. I'm on my learning journey. And the work that I'm going to be presenting here is about patterns of white dominance in healthcare. Before I jump into that, I actually want to do a little check-in. So I'm putting a link into the chat. If you could click on this and answer the question there, that would be awesome. Oh, gotta let you answer it. Okay, there we go. So I'm wondering how you're feeling in this moment. And I see people clicking. Can see the numbers coming along here. There's people entering with different feelings into this presentation. So there's some nervousness. A lot of people are feeling curious. I see some people feeling hopeful. Some people are feeling guilty, and that's like common. These are all like common feelings when we're talking about racism and whiteness. Some people are feeling upset, determined, and exhausted, and other. Of course, I couldn't get all the feelings on here. So I see like 90-ish people have already answered this question. I am really grateful for you participating in this session. I hope that that I don't just talk at you, but that we can have some interaction today. So the reason that I'm asking about how you're feeling right now is because I think it's really important to acknowledge that while there can be difficult feelings that come up during anti-racism education, it is really important to like be able to check in with those feelings and observe them and not judge ourselves for them. So I invite you into that today. So let's get started on what we're talking about today. So a little bit about me. I want to tell you about my social location. And to me, that means intersectionality. That means the intersections of my identity or the ways that I hold power in society or experience oppression in society. So I'm a white settler. I am an able-bodied cisgender woman. The pronouns I use are she and her. I'm a registered nurse, I'm a clinical instructor, and right now I'm a grad student. I'm a master's student. I get to study educational foundations, and my focus is on anti-racism education. And I get to learn from Dr. Verna St. Dennis. She's supervising my thesis, and I aim to be accountable to her as a person that's been instrumental in my learning. I'm so grateful for how she's taught and guided my studies. And I want to give a shout out to some other of my mentors, and some of them are in the room today. So thank you so much, Dr. Manuela Valle Castro, for all that I get to learn from you, and to Dr. Holly Graham, to Becky Sasakamoose-Kuffner, and to Sheila McLean. These are mentors who I aim to work with and be accountable to, in addition to being accountable to my community. So for me, accountability means I hold a lot of power, and I want to use my power to create a world that's more equitable, a world that has that treats people better. And throughout this presentation, I just put this questions thing here, and I think Erin went over what to do with your questions. You can put them in the chat, and people will be monitoring the chat. If you have, I'm going to try to use the most simple language that I can, but you know, I've spent the last couple of years reading all this stuff and learning all these big words, and sometimes I'm saying the big words without even realizing it. So please put in the chat if you want something defined better. If I say a word that you're not sure of and you want me to go back to it, and I would like to try to be as understandable as I can. So I want to look at all of these things I've underlined. These are I think about Kimberly Crenshaw's idea of intersectionality. And with this idea, she's looking at, she talks about how our identities, all these different ways that we move through the world and we're treated in different ways, they kind of interlock. And so the identities that I'm bringing in, that I move through this world with, are that I'm white. So that means I'm on the benefiting side of racism. I'm a settler, so I'm on the benefiting side of colonialism. I'm able-bodied, so I don't experience ableism. I have able-bodied privilege. And I'm cisgendered, so that means I was assigned female at birth, and that matches up with my gender, who I feel I am. And so I'm on the privileged side of gender that way. I'm also a woman, so I've experienced sexism, and I know what it's like to be a little bit worried about going out alone at night. And so I've experienced the oppression side of sexism. There's classism. I'm in the middle class, so I don't get the discrimination that people get when they're living in poverty. And kind of where my job and my studies are indicators that tell you a little bit about what my social class might be. And so because I don't experience racism, ableism, or classism, I have a lot of privilege and I have a lot of benefits. And so that's where I'm coming from in this work. And I think it's important to tell you that. So what I want to do today in this session is I'll tell you a little bit about why I came to anti-racism. I'll tell you what my research is about. So I'll tell you a little bit about what I've read and about how I did my research. And then I'll talk about the findings, what my research found out. And it's about whiteness and how whiteness gets performed. And I looked for patterns in what I studied. And the reason that I think it's significant to be studying this is because we need to work towards racial health equity. So when I say racial health equity, I mean that we shouldn't see these huge differences in how much access to health different groups have, where white people have lower rates of certain illnesses and Indigenous people have higher rates of certain illnesses. And there's a lot behind that, and it comes back to colonization. And so I think we need to learn to do better so that we can have less suffering and more health, more even health. This is a little bit of a warning that there might be some uncomfortable parts. So you might feel a little bit uncomfortable, especially if you're white. You might not be used to being having your whiteness acknowledged, or you might not be used to thinking of yourself in that way as a white person. And sometimes it can feel a bit uncomfortable, like a little bit of guilt or a little bit of shame, or maybe remorse for something that you said or did that comes up in the session, and you're like, oh wait, what was I doing? And that can feel uncomfortable, but it's really not the same as experiencing racism and the actual harm that happens for Black people, for Indigenous people, and for people of color. And so please try to view your discomfort. If you're a white person feeling discomfort in the session, please try to view that discomfort as useful. It's an opportunity. It's trying to tell you something that, like, ooh, this is like shaking up what I believe or what I'm comfortable with. It helps for me when I experience the discomfort of anti-racism. It helps for me to remember my ancestors didn't suffer. I don't suffer the experience of racism, and I don't suffer from those harms. And so feeling a little bit of discomfort, that's okay. So what brought me here? As a registered nurse, I've seen racism in healthcare. Sometimes that happens like interpersonal racism, where people say stereotypes or people say harmful things. But I've also seen how it's part of the whole system. It's not just interpersonal interactions. I try to take this bigger picture of looking out, zooming out to see what are the racist outcomes. So rather than just seeing racism as like something that hurts someone's feelings or maybe even like caused physical harm, it's even bigger than that. There are outcomes at a system level. And so my friend Russell McCauley made this beautiful video, and I took a screenshot of this slide, and I have the link for you to watch this video. It's a half-hour video about anti-racism, and Russell's pointing out on this slide all of the outcomes that Indigenous people in Saskatchewan face because of racism. So these are very real: the poverty rates, in food and housing insecurity, environmental racism and intergenerational trauma, child apprehension, over-incarceration, culturally unsafe practices being done to Indigenous people, and cuts to programming. And these are pretty huge. This is has huge impacts on people's lives. So racism isn't just saying something mean to someone. It has all these huge impacts. And so that's my understanding of why we need to work towards a better society, so we don't have Indigenous people experiencing all these terrible things. And because these harms are acted onto Indigenous people, sometimes we forget that, like, it's not the people who are experiencing the racism who are the problem, it's where the racism has come from that's the problem. Indigenous people didn't colonize themselves. So this is on white people. This is on colonization and coming over from Europe to take the land. And that happened because of white supremacy. So when I say white supremacy, I don't mean like KKK or Proud Boys or white supremacists. I mean white supremacy as a way of seeing whiteness as the best, whiteness as the top, and everyone else below. And so to me, when I look at all of these outcomes, I see the symptoms, and the problem that made all this happen has to do with whiteness. And so what do I think is the way of moving forward to create a better situation? Well, the Truth and Reconciliation Commission Call to Action 24 says that medical schools and nursing schools need to have anti-racism. We need to teach this to new doctors and new nurses. And for me, what anti-racism means is a way to address the harm that's happening, a better way to move forward. So it's part of a solution, I think. So when I say anti-racism, that's like one short word, but it has a lot of meaning for me because I've gotten to read a lot and learn a lot over the last couple of years about what the pieces are that go together to make up anti-racism. So when I say theory, I mean like what have people written about? What have authors and researchers and scholars written about? And there's a couple of big theories that I'm going to mention that really influenced my learning. And one is critical race theory. And critical race theory says racism, it can be interpersonal, but it can also be invisible and systemic and kind of sneaky, right? So sometimes it's kind of hard to see it. And it happens because race categories were made up by white people, socially constructed. That means they were made up. It's not like scientific categories of races that science has been debunked. It's not good science. So it's just people deciding to make these categories. And who decided? If you go back in the history and look at that history, it's white scientists who decided that these categories exist, and it's white people who have benefited from these categories, because these categories allowed people, white people, to say, okay, Black people can be enslaved, we'll exploit Black people for the labor because they're not as good, and we'll exploit, we're at the top, and we'll take this land because it's lived on by people who are not white, so not as good. So critical race theory says we got to turn the focus away from the people who are experiencing racism, from Black people, Indigenous people, people of color. They're not the problem. The problem with racism comes from whiteness. So we're turning the focus away from who experiences racism to who's benefiting from it? Where's this racism coming from? Who is it serving? And critical whiteness studies says that whiteness gets made out to be normal, or like the default, or like natural. And so we have to make it strange to study it. And I relate a lot to this because though I just like have, lived my life as a white person, and that's how I live my life. So it's normal to me. And so for me to learn, oh, what's the problem with the way that I've been taught to be white? I need to make it strange in order to learn that. And that's hard because this sentence here, investment in whiteness, obscures our complicity. So that means the people who are benefiting from whiteness, it's like it has this default like defense mechanism where we can't see our whiteness. So we don't even realize that we are performing whiteness sometimes when we're doing it. But we can learn how. We can learn how it happens, and we can learn the patterns, and there's lots that's been written about it. And so that's what I'm trying to do here with my research. So methodology means like, how did I do my research? And post-structural discourse analysis is the name of the way that I did my research. And it looks at discourse being productive. So that means that our words, our language, they do things. They're not just describing things, they're actually doing things. What kind of things do our words do? They construct identity. So that means they we understand ourselves in certain ways, and our words are really important in that. And for white people, we understand ourselves, a lot of the time we understand ourselves as superior. And that's part of the problem, right? Of this inequity, why we have like all the inequality in the outcomes. So we gotta always bring it back to impact. Like, what are the impacts of our words? And in my research, I'm really trying to not look at what did my participants who said things, what did they mean? I'm not trying to think of like their intention. I'm trying to look at what do their words do. So that's how that's an important part of this methodology. So I'm not trying to criticize my research participants. I'm super, super grateful for their willingness to volunteer and let me research what they said. And so I looked for patterns in what they said. So what did I find? Oh, first of all, how did I do it? I took a focus group of white nursing faculty, And they had all participated in some anti-racism training, just a little bit of introduction to anti-racism. So after they had done that, I took the participants and we met and talked about it. We talked about the anti-racism training, what parts of it were uncomfortable, what kind of next steps do they want to do in their anti-racism, what kind of support do they need to work on anti-racism. And then I transcribed the session that we had and analyzed the transcript. So I took those words and I kept asking myself, what are these words doing? And I found some patterns. And through the patterns, I put them in 3 categories: how they talked about anti-racism education, how they talked about racial others, so people whose race who get racialized differently than they did, and they're all white, so their own white self-identity. And I'm only going to talk about the 3rd one today because I don't have time to go into the other ones. But everything that they said, nothing was new. Everything was the stuff that I had read about and that are patterns in the literature. There's people who have written tons of stuff about the things that I also found. And so I'm going to go through a bunch of these patterns. So there's 6 big things that I pulled from what their words are doing. 6 big parts of identity. And the first one is innocent and benevolent. So the white people in this study, and white people more generally, we tend to think of ourselves like we want to be blameless. And we want to see ourselves as progressive agents of futurity. So we're bringing a better future, but we're not always willing to see ourselves as participating in a harmful system currently. And that means we don't always see ourselves as responsible for doing better and for making change. And sometimes this innocence comes out like we're trying to let ourselves off the hook because we know that we are good people. We know we're caring. We know we're compassionate. And so that is that focus on intention. Like we wouldn't hurt someone. And so remember, we need to focus on impact instead of intention. So the second way that white people tend to construct ourselves that I'm going to talk about, and there's lots more ways. I'm just like choosing these 6 because they were the most, maybe the ones I had read the most about. The second way that white people construct ourselves that I'm going to talk about is heroic. So this is like white saviors. So, or the lone white anti-racist hero, like I'm going to come in there and I'm going to protect people. I'm going to save people. And this can be like a way where we're performing whiteness because we want to be innocent. We want to be like the ones who are saving. And so that's another pattern that comes up. So yeah, that heroic one, another name for it is white savior. And then the third one is the knower. And this one comes from, this one's like, I think it's really like, there's some irony here that I'm like doing all this talking. I've been talking for like 20 minutes and like telling you all sorts of things. And like, how does that, like, obviously I struggle with this one, the white person as the knower, as like a teacher, someone who teaches nursing. And like, I mean, I'm teaching this term, like, how do I not struggle with being the knower? Like, but for white people, the way that we do being the knower, it is all about like superiority, because the one who knows is like the authority. They're like at the top. There's that hierarchy there, that power. And it can also be that like as a white person, when I'm thinking about myself as the knower, like, oh, I already know that, therefore I don't have to learn it. So it can be a way that we avoid doing the difficult work of learning and unlearning because it's uncomfortable, that work. And that discomfort of not knowing, that can be another thing that we do. We're like understanding ourselves as the knower so that we don't have to understand ourselves as like not knowing, because that's kind of scary and uncomfortable. And the fourth pattern that I'm going to point out is neutral. So white people, sometimes we think of ourselves as neutral, that we don't have power. And that ignores all the history, that ignores the racism that's led us up until this point of where we're at right now. As a white person, I have the power of not experiencing racism, of the systems being made to benefit people like me. And I've been socialized into this way of thinking. So as white people, we think of ourselves as neutral. We think of ourselves as not powerful. And whether we're aware that we have this power or not, we're socialized into it. And Thandika, in her book from 1999, talks about how she gives this like snapshot of white people getting socialized into whiteness. And being socialized into whiteness, being socialized means like you learn how to be, you learn what's acceptable, you learn what society says is okay. And for white people, the expectations are that like we perform whiteness. We learn how to do that. So her book is called Learning to Be White, and I recommend it, even though it's, you know, like 22 years old, still really, really good reading there. And that way of us thinking of ourselves as neutral, it's kind of like that defense, that built-in defense that whiteness has, where it doesn't want to learn about things that threaten it. So that can kind of contribute to us not even realizing that we're doing this. The fifth pattern that I want to talk about is exceptional. So Layla Saad, in her amazing book, Me and White Supremacy, which is like a workbook, a journal, she talks about how we like, as white people, she's a Black woman, and she's like teaching about whiteness. And I think sometimes like white people, we don't even realize the ways that we perform whiteness. And sometimes we need to hear from people of color who are on the receiving end of racism what we are actually doing, because we don't even realize what we're doing. And so in Layla Saad's book, she talks about white exceptionalism, and it really hit me hard how she talks about it, because she talks about like being one of the good ones. And I have definitely, I always like am battling with this idea that like, well, I'm one of the good ones because I'm studying anti-racism. Nope, I still do whiteness. I still do whiteness in ways that I don't even realize. And so I need to learn how to unlearn that. And sometimes exceptionalism is like, I'm one of the good ones. I'm not like those other white people. I'm not like those racist white people. I'm one of the good ones. Yeah, that one hits me hard. That's a big one for me. The sixth pattern that I want to talk about is complicit. And this one's a little different from all the other ones, because in this one, there's like a bit of seeing our own whiteness and how our whiteness is happening. And in this complicit pattern, which I also like saw from in my research participants, it's like we are starting to understand like, whoa, the things that I'm doing are contributing to this. I need to change. And so Harsha Walia talks about white guilt that can come with this complicity. That guilt can be a sign that we need to shift our consciousness. And there's like this, we can feel thrown off, right? Like, oh, when we realize this, like, oh, wow, I got to change. There's like a couple of options. We can dig our heels in and like be in denial and be like, no, I'm a good person. I'm not doing anything harmful. Or we can, another option is to take an anti-racism approach of trying to learn how our whiteness is happening and trying to unlearn those patterns. So my next part here is a bit more interactive. So maybe open up your chat box. We'll need some responses. It is a matching game. And so what I have is a bunch of quotes, a bunch of pieces of data that I took from my research where white people are doing whiteness. And like, to me, they're like examples of each of these 6 patterns. So I want you to try to put yourself in the role of the post-structural discourse analysis researcher and try to match these up and try to guess how I matched them up. Oh yeah, before we go on to that, I put this embarrassing picture here because sometimes I go through this slide and don't even say like, wow, I do these things. These aren't just patterns that other white people do. Like these are things that I do and I'm trying to unlearn, and they're not very flattering. So I included this not very flattering photo. Okay, so here we have in the middle, there's the white self, and then the quotes will show up all around. And then I'll get you to type into the chat. Is that going to be possible for people to type in the chat? Yeah, cool. Okay. I'll get you to type in the chat what quote you think goes, or which identity you think matches up with that quote. So the first one is, we know more than we think. So type the number in the chat. What do you think it is? Is this a pattern of being, oh, I see a lot of guesses. Okay, people are guessing 3. Yeah, I see a lot of 3s. Okay, that's also what I said for this one. We know more than we think. It's about like being that knower. And then I have to move everything around so it's not in the way of my text here. Okay. How about this one? We're nice people and we're coming from a good place, and hopefully people understand that. Wow, some people are really fast to guess. Thanks for all this participation. I'm like, yay, people are with me here. Number 1, popular guess. Okay, yeah, that's what I thought too. It's about innocence and benevolence. Like we're good. We're good people. It's focusing on intentions, right? Coming from a good place. And that can have the effect of ignoring our impacts. Okay, so this next one, when people make those comments, like maybe racist comments, do I stay neutral? A little bit of a giveaway because I have that one word there. Don't overthink this one. Yeah, I meant neutral. So for me, I thought of neutrality with this one because just that idea of staying neutral. Who's neutral to begin with? Are white people neutral? We're always coming from a place of not being neutral. We're all entering it with our socialization that we have. Okay, my next one is, the people who maybe really needed to be there don't come to those things. So this was talking about the anti-racism session and reflecting on like who was there and who wasn't there. See a lot of people guessing 5. Yeah, so like the subtext here, the part that they didn't say is like, we're the good ones who showed up. It's the people who didn't show up who maybe really needed the anti-racism training. But us, we showed up, we're already good. So yeah, like those good white ones. So that's, this one, like this stood out to me a lot because I have these white exceptionalism thoughts a lot. So that one was big for me. How about this one? How do you protect people when you're not in the same room? Oh, got a little thing in the way. How do you protect people when you're not in the same room? See a lot of guesses here for number 2. Yep, that's the one I was trying to get at. So that like that protecting, heroic, saving. Why is it this person's job to protect people? Is it? And that is number 2. And the last one I have here is, oh my, I'm contributing to this. Yeah, process of elimination. Only one left is number 6. You got it. That's right. Or that's how I understood it too. So this is where the person was reflecting on things that they had said in the past, and they learned that like, oh, the way that you're talking about this could be causing some harm, and their reflection on that was, oh my, I'm contributing to this. So They're recognizing their role in it. So at this point, I want to have another little check-in, because I think we've, this is like the part where you might be having some emotions. So I'd like you to go back to this. I put it in the chat. I'd like you to go back to this poll. And oops, I haven't here. Sorry, starting now. I'd like you to go back to this poll. And I put the new questions up here. I said, talking about whiteness tends to generate a lot of emotions. Are you feeling any of these right now? Are you feeling any anger, any hope, any guilt, any shame, any annoyance, any discomfort, any not me, so denial, any motivation, uncertainty, danger, embarrassment? So there are a lot of, and I see in the chat people are answering too, some feelings of less heroic, good, excited, reflective. And I see, wow, there's lots of motivation. And like when we see these feelings, this can be uncomfortable, and some of these feelings are uncomfortable to feel, right? It's not very fun to feel guilt or shame. It's not very fun to feel discomfort or defensiveness. Like, these are unpleasant feelings, but none of these are wrong, and all of these can be helpful in moving forward in a good way, I think. Like, it's important to acknowledge what feelings we are having, and I think the most useful ones are those uncomfortable ones, because they can show us where we might have more work to do, or more to focus on, or something to kind of come back to, like, oh, why did I feel anger about that thing? What's going on there? And yeah, like I said, whiteness does things in all sorts of ways that we don't always understand or see. And so those feelings can be a place to connect and to move forward. So this next part here, I have just what I see as, like, coming out of this research, what I see as the next steps. So for nursing programs, since this was focused on nursing faculty, and since I'm a nurse and I work in a nursing program, I think nursing programs really need to support the faculty to develop anti-racism skills. And I think we need to do this using the theories that I mentioned before, critical race theory and critical whiteness studies, because I think that there's tons of evidence and research and writing out there that we could be using in nursing to prepare our nursing faculty to engage in anti-racism, to learn how to be anti-racist. And I think we need to push for anti-racism at a program level, like for our whole program to want to say, like, hey, we want to be an anti-racist nursing program. But I think we also need to have anti-racism in the classroom level, and not just like as a topic dropped in, but like as an approach that we take to our nursing instruction. And I think to do this, the nursing programs need to nurture the vulnerability and the humility in white nursing faculty that's necessary to do this work. So that brings me back to this quote, and I feel like I still have a long way to go. I think that's like, we need to be encouraging that attitude of not being the knower, but being the learner. We're trying to learn anti-racism, and we're trying to unlearn the harmful ways of our whiteness. For people who are wondering what steps, if you're a white person, I encourage you to keep reflecting on your language and the impact that our words have. We need to learn to do better. We need to read and listen, especially to BIPOC activists and scholars. So if we are white people and we want to do this work, we need to, you're here listening to me today. How about the next session you go to, listen to a person of color who's talking about racism and who's providing that education. So seek that out, seek out the work that has been done, the brilliant work of people talking about racism who have actually experienced racism, because I'm a white person, I haven't experienced racism. So you got to learn from not me. So I think we also need to unlearn these patterns in ourselves. And so white people, I just encourage you to, I only touched on 6 patterns, but there's tons more out there that you can read and learn about. And since we've learned our whiteness, since our whiteness is something that we've been socialized into, it's possible to unlearn it. So let's practice that. I have a practice here and I have some resources to send with you, but maybe first I'll pause there and see about questions that people have, because there were some questions submitted ahead of the webinar, but they weren't really about this topic. They were kind of tangentially related. So some that aren't really focused on like whiteness or white dominance, but I would like to give an opportunity for people to ask questions. Or maybe you've already asked a question in the chat and maybe Erin can tell me where we're at with questions.
Yeah, so please do add your questions and comments to the chat. I've received a few, so I'll just mention them here. I wonder if you've had any input into the anti-racism workshop, any input into the workshop that your participants took part in. How do you feel? Do you feel the content would have made a difference to the impact it had, or would any introductory anti-racism training have had the same effect?
Wow, that's a fascinating question and something I've been thinking a lot about this last week, because my supervisor gave me back my first draft of my thesis and we had talked about what I need to change and what I need to learn more about and write differently. And something that she said is like we need to understand that like the people who participated in this research, they're the learners. They're the ones who are learning anti-racism. And so the things that we found out in this research can tell a lot about what we taught. And so, yeah, I don't think that like we taught it perfectly. And I think there's still a ton more to learn. And also, this was just the first. I had my focus group after the first module. So they had 2 full days of anti-racism, but you can't learn a lot of anti-racism in 2 full days. It was like, you can take courses on it, right? Like whole semester courses and like you can do a whole master's focus on it. Like there's so much to learn that, yeah, we definitely need to work on what we present and what we focus on. But yeah, I definitely think that it might have been a little different what people shared in the session. But like, I do want to say people in the session, the participants who did this focus group, they like overwhelmingly really liked the anti-racism session and they felt they learned and grew a lot from it. And they felt like they had more work to do. So they're super on board with anti-racism. And they also said things that like showed their whiteness. So like even if we're trying our best and learning anti-racism, these patterns are still common in us. Yeah, hopefully that addressed the question a little bit.
Perfect, thank you, Rissy. And your sound is breaking up a little bit. I know we have lots of folks on here, so it could be a bandwidth issue. So hopefully that'll just sort itself out. A few more questions, and if you have any questions, feel free to text them or put them in the chat. You're muted, so it's just again for bandwidth issues. If you can text them, that would be preferable. Another question is how do we become aware of unconscious racism or behaviors? How do we know the impact?
Well, I think we need to listen to people who have been experiencing it and speaking out about it for decades, centuries. So there's lots of like for white people, like a lot of the time it's like those voices are there. They're already what needs to be said has been said, and have we listened? So I think it's about where we're looking for those answers of how to address these biases. And like I mean, I think it's really important to look for the patterns. Like that's why I focused on that in this session, because learning those patterns made me see it in myself, and to realize like how deeply rooted it is. But yep, my number one thing is listen to the people of color, to the Indigenous people and the Black people who've already written and spoken about this.
Perfect. Sorry about that. Thank you. Given your perspective as both an RN and in your studies in academia, do you feel a single prerequisite of Indigenous studies at the 100 level in the Bachelor of Science in Nursing at the U.S. is conducive to creating a culturally safe healthcare system for BIPOC folks?
I love that question. That's a lot to think about. So I am really grateful that there is a requirement to learn some Indigenous history prior to coming into a nursing program. I also think that that requirement has been there for a while, and have we seen a huge change in outcomes? Not so much. There was Joyce Echaquan died at the hands of registered nurses this past year, and I mean, yeah, that's in Quebec, and people will say like, oh well, in Saskatchewan we have this requirement to learn about Indigenous people before this program. I'm glad that there is a requirement, but I think it's very minimal what we have right now. And I think it also that we need to learn the history, and we need to learn how to be critical. And sometimes those are different courses, or sometimes those are together. But learning Indigenous history doesn't necessarily mean that we can see racism today. Sometimes that it has the effect of nursing students thinking like, well, it was in the past, like residential schools are over. So it's not a big impact on health right now. So we need more history, more Indigenous content, I think, and we need the critical training to see like how it's still causing harm and how we are involved in it and we're participating in that harm. So right now, I don't think that there is enough Indigenous content in nursing, and I don't think there's enough critical content. So I think we have a long way to go on both of those. And I'm only familiar with the nursing programs in Saskatchewan, so I can't speak beyond that. But I have worked for both of the registered nursing programs in Saskatchewan, so I would like to see more in both of those.
Perfect, thank you. And Dr. Tate, you had a question.
Yeah, I guess it's a question and a comment is that one of the things, and thank you for your talk, but one of the things that I'm struggling with right now is that whiteness is also patriarchy, and it is also patriarchal hegemony. And I think in your talk, ignoring, just kind of blanketing as something that's called whiteness is problematic. And so as a Métis person, when I look at systemic violence and I look at the origins of systemic violence, I go to patriarchy, and I go to the fact that the decisions that you were talking about that were made by white European men who were in positions of power. And so when you look at Saskatchewan and settler society in Saskatchewan, that if you look prior to many of the policies that existed, that there were settlers who arrived here that were oppressed in the countries that they came from and worked very closely with Indigenous peoples and farmed together and had relationships together. And my history has some of those really good relationships of people working together. But it was the policies that were created by a patriarchal system that was about control and about oppression. And so I think in this argument that I have a level of uncomfortability without that being acknowledged, because feminists, and including a lot of white feminists, were highly instrumental in changing the conversation, not only around gender, but also around race as well. And certainly, I think that, I would hate to not acknowledge the role that they played, and they certainly played it because in sociologically they were situated in places of power. So yes, their whiteness, but I think, and then we did see a critique by Black feminists and Hispanic feminists and critiquing some of what white feminism did. But I really feel that it's important that we acknowledge that these battles have not been such a dichotomy, right? And so I just want to add that into the mix a little bit.
Thank you. I really appreciate you bringing that up and making shedding light on a bit of the complexity that I didn't touch on at all. Yeah, there's a lot of selection or paring down or oversimplification that went into my presentation, and yeah, I only focused on the whiteness piece of it, but yeah, certainly the patriarchy and capitalism, colonization, all of these things are so closely entwined. Homophobia, like all of these things are so closely entwined, and I think any anti-racism needs to come from a place of also anti-oppression education, that it needs to be more than just about race, because our identities are interlocking and intersecting, and the systems of oppression are not so clear to delineate what's racism and what's patriarchy, because it's all blended together. Thank you very much for that.
So we are at 1:30 and time goes fast. So I'm unfortunately, we're going to have to end it there, but I just want to really thank you so much, Rissy, for sharing your research and guiding our conversation, sharing your knowledge and your openness and humility on this important topic. As I mentioned earlier, this is such a big topic, and I just really appreciate you starting this off. And I really hope that this is the first of many of these conversations that we host together in this webinar, and maybe even in more sort of informal conversations. I just want to thank everyone for being here. And again, thank you so much, Rissy. As you leave here today, I just want to invite you to reflect on what you heard and maybe ask yourself, what did I take from this? Perhaps what challenged me in the way that I understand the systems I live and work in, and what felt relevant and helpful. You will hear from us soon with a short feedback form, and I'm actually going to put it right now in the chat. It's always better to do it right away. It really will only take 2 to 3 minutes. We really do value your feedback. It's really helpful and helps us to improve our future sessions. So stay tuned also for more information about our next session, which will be in early April. And if there's nothing else, thank you so much for all your comments in the chat. I just really want to wish everyone a wonderful rest of your day and weekend, and just be safe and take care of yourselves and each other. Thank you so much.